Hello, everybody. Happy Monday. So it's March 24th, 2025, and we are back again for our CCS Exam Prep. Last Wednesday, I provided you with an introduction to the ICD-10-PCS system. And today, we're going to continue that conversation focusing on root operations. Now, as always, it's so important that you take notes. I have a lot of information to cover tonight. As usual, I will do intermittent breaks so that you can have a moment to stand up, get some water, etc. So let's dig in. So last Wednesday, we talked about the fact that the ICD-10 PCS system is used to code hospital inpatient procedures, and that the majority of the codes in this system are found in the first section, which is the medical and surgical section. As such, you will find that our conversations in this CCS exam prep will focus on the medical and surgical section. So let's do a little review. So, all ICD 10 PCS codes have 7 characters. And in the medical and surgical section, the first character represents the section, which is always a 0. And I'm trying to look at my 0. I think the font is making my 0 look bigger. Why I mention that is because the letters O and I are not used in the PCS system. So the first character in the medical and surgical section is a 0, not the letter O. The second character in the medical and surgical section represents the body system. There are 31 body systems. And last week we talked about why, so I won't review that. The third character is the root operation. In the medical and surgical section, there are 31 root operations, and I've already mentioned that you needed to make flashcards. I hope you have those flashcards. On Wednesday, you will have an exam that will be 100 questions where you are to identify the root operation only. I think there are about 80, don't quote me, let's just say 80 something multiple choice, and then the other 18 or 20 are fill in the blank. The fourth character is the body part. The body part is in relation to the body system. The fifth character is the approach. There are 7 approach options for medical and surgical. The sixth character is the device, and there are 4 groups of devices. And last and certainly not least, the seventh character is the qualifier. Not all codes have a qualifier, so the most commonly used qualifier is the letter Z. Last week, I also gave you a sentence to help you remember the 7 sections, which is Susie buys root beer at Dairy Queen. So, to correctly build an ICD 10 PCS code, it is critical that you select the root operation and the body system to arrive at the correct table. The code table, as you may recall, is 3 characters, which at the top, upper left hand corner, shows you the section, the body system, and the root operation. We also talked about the fact that you, as the coder, has to review and analyze clinical documentation to determine what the root operation in the body system is. Physicians do not learn ICD-10-PCS coding, so they do not know anything about a root operation. That is our job. All right, so last week I mentioned to you that the root operations were um, divided into 9 groups. I also recommended that you study them in the groups. Now, I will tell you on Wednesday, the questions will be random, meaning it won't be by group. But one piece of advice that I want to give you, because on Wednesday you're going to just log in and go straight to the exam. But one piece of advice I would give you is take the time to learn the root operations. You definitely can have the flashcards in front of you on Wednesday, but just keep asking yourself, what is the objective of the procedure? All right, so we are going to start with group number 1. And these are root operations that take out some or all of a body part. And these root operations are excision, resection, detachment, destruction, and extraction. And in this particular group, think about it. The body part is the focus of the procedure. So, um, what you're going to see, some of the major differences in these root operations, as I am about to dig into them, is really the amount of the body part that's actually taken out, right? A portion or all. So let's dig in to our first one. Um, you should have your PCS guidelines in front of you. If you don't, on one of the breaks, just go ahead and grab them. I have mine in front of me and my reading glasses. So when I cover the root operation, I'm also going to tell you what the character value is. And I think this is important because when you take your CCS exam and you have a multiple choice question, knowing what that letter or number indicates can help you move quickly. All right, so first root operation is excision, character value of B, cutting out or off without replacement a portion of a body part. So, a key distinction in this root operation, and this may be something you want to underline on your flashcard, is that only a portion of the body part is removed. If they take out the entire body part, then the root operation would be resection and not excision. Some examples of these procedures are found in the index of your PCS manual. They also have some examples in the guidelines, but basically, it's part of a body part. So, partial gastrectomy, removal of part of the stomach, removal of a cyst, excision of a lesion. And I think the other thing that I want to call out before I forget, excision is also a root operation where the doctor could be wanting a biopsy. So, and in this particular case, you would use the qualifier of X, and X is only used for biopsies. The intent of the procedure has to be to remove a portion. I keep saying that, a portion of the body part for purposes of analyzing the body part. If you don't have documentation that the specimen was sent to the lab to evaluate, to find a diagnosis, then you would not have the diagnostic qualifier. There are there are lots of guidelines that apply. So one of the reasons that I mentioned you should have your guidelines is because I'm going to really try to cover them. And let me just tell you that if for some reason I don't get through all 9 groups in this 3 hours today, I will continue on Wednesday because I want to make sure we get through these, because after this, it's just going to be coding, coding, and more coding. So, as I was going through the guidelines, there were 3 that stuck out for me related to excision. The first is B34A, which basically says, and I'm not going to go through all the guidelines because I'll never get finished, but this one in particular says biopsy procedures are coded using the root operations, excision, extraction, or drainage, and then the qualifier of diagnostic. B34B is covering if a diagnostic, extraction, excision, drainage is followed by a more definitive procedure, what you should do. And then the other guideline that I wanted to call out, and hopefully you have your guidelines spiral bound or some form like we talked about, is guideline B39, which talks about an excision for a graft, and it tells you what to do there. So I wanted to just call those 3 guidelines out. I'm sure when you read your guidelines this past weekend that you actually saw these guidelines. All right. So the next root operation in group 1 is resection, which is defined as cutting out or off without replacement all of a body part. Examples are a total mastectomy, a lobectomy of a lung, and an appendectomy. So, in comparison to excision, you're taking out part of a body part. Resection, you're taking out all of a body part. Oh, wait, there's more. The character value for excision is a B. The character value for a resection is a T. And the term body part in the root operation definition refers to an individual body part. And that's the body part that is related to what? Character to a body system. Okay. Now, we already know that the body systems are expanded. And so, one thing that I want to call your attention to and ask that you go take a look at is that the respiratory system has 9 possible body part values for unique areas of the lung. So take a look at that, because you heard me say that a lobectomy of a lung could be a resection. And so if that whole body part is taken out, that is a resection. So that respiratory system, you'll see things like upper lung lobe, middle lung lobe, just to name a few. All right, I want to call out guideline B38. And guideline B38 speaks to excision versus resection. And the example they give you is that left upper lobectomy. So you've seen that multiple times. All right, going on. Oh, you know what? I think there's another one, but I think I already mentioned it. I was trying to keep my thoughts straight, but I think I've already told you about B318. Let me just go back. No, I didn't. I didn't. So, um, let me call out guideline B318, and I don't have it on the slide, but it's B318. And that guideline says if an excision or resection of a body part is followed by a replacement procedure, code both procedures to identify each distinct objective, except where the excision or resection is considered integral and um, they use a word that's so easy but so hard to pronounce. Preparatory for a replacement procedure. So preparing for a replacement procedure. So in your notes, add in B318 is a guideline that you want to make sure that you are paying close attention to. All right, I think I am done with resection. Now I am going over to um, the third root operation, which is detachment, which is cutting off all or a portion of the lower or upper extremities. So here's one thing I want to call out that I think is important for your notes as you're trying to figure out, like, man, what is the difference between these different root operations? Well, it's the little things that matter. So first things first, it has to be upper or lower extremities. And in particular, what you're going to see is that this is for anatomical regions where there is a detachment procedure. And a detachment procedure is a fancy word for like an amputation. So I would encourage you to go over to tables 0x6, 0y6, because those are the tables that are available. Now, there are some guidelines. So I want to talk about guidelines first. B319, which is for detachment procedures of extremities. And why this guideline is important is because it gives you definitions that were developed for the detachment qualifiers. And you are like, okay, what are you talking about? Well, and I don't have this on the screen, but if you go over to, for example, in the tables to table 0x6 in your PCS manual, you'll see that the qualifier options are like high, mid, low, and then complete, partial. And in the guidelines, this is page 12. I told you I have mine in front of me. There's a table that gives you a definition of high, mid, and low. And then you find definitions of complete and partial. So, again, I hope that you guys are really taking the time to go through these guidelines because they are absolutely critical. All right, the last root operation for group number one is going to be destruction. And destruction is physical eradication of all or a portion of a body part by the direct use of energy, force, or a destructive agent. And it is character value 5. I don't know if I mentioned that for detachment, which is a 6, but just want to remind you about that. So, what do I want to tell you here? So, this particular root operation, you're going to see a wide range of procedures performed on a variety of body parts. And you're going to see um, terms like coagulation, cryotherapy, fulguration. Those are names that you will see. Oh, another term is coblation. That's another term. Okay. Let's see. I don't think I have any guidelines. Let me go to the next slide, but I'm also going to just look at my guidelines. And oh, there's one more root operation. It's not the last one. All right. So here we have extraction, which is pulling or stripping out or off all or a portion of a body part with the use of force. And as I was looking in my notes, I don't see any guidelines for destruction. All right. So extraction. So, in comparison to destruction, which destruction eradicates the body part or a portion, right? Extraction uses force, such as suction, to complete the objective of the procedure, which, as the definition applies, is to pull or strip out all or a portion of a body part. And this also is different than excision and resection because those are cutting out of a body part. Okay. It should be noted that minor cutting, such as in vein stripping procedures, is included in extraction if the objective of the procedure is met by pulling or stripping. Okay. And then the approach character actually involves cutting used to get to the operative site. All right. I know there's a guideline, and I did not have it on the slide, but the guideline B35, and I'll give you a moment to go over there. B3, yeah, B35. No, that's not it. Oh yeah, that's it. So much going on here. So much going on. So look for B35 real quick. And that particular guideline says overlapping body layers. Overlapping body layers. So if a root operation such as excision, extraction, repair, or inspection are prepared on overlapping layers of the musculoskeletal system, the body part specifying the deepest layer is what is coded. I will tell you in case you're wondering, like when I first learned ICD-10-PCS, I was like, man, there's a lot of stuff going on here. And I kid you not, because I learned ICD-10 in a weekend situation. It literally was, I had to force myself to do a couple of things. Number one, I had to retrain my brain to these definitions for PCS. That's number one. And then number two, I had to do like we always do in coding. I had to just learn the rules. Okay. So that was B35. Oh, I have a tip for you. If you have a bone marrow tissue and an endometrial biopsy that's removed by pulling or stripping, that is also coded as an extraction with the diagnostic of qualifier rather than excision with a qualifier. I will, between now and Wednesday, I'm going to try to pull together a list of tips for you. Okay. And we are going on to group number 2. So let's just take a 5-minute break. I'll play the music for 5 minutes and then we'll return. All right, guys, we are back and we are moving on to group number two, root operations that take out solids, fluids, gases from a body part. There are three root operations that are in group number two. So, just to differentiate from group one versus group two, in these root operations, the focus is not on the body part, as was in the case of excision, resection, detachment, destruction, and extraction. Instead, the focus is on something that should not be present, such as a foreign body, um, excess fluid, solid matter, just to name a few. Okay, so let's get started here. And the first root operation, drainage, character value of 9, is taking or letting out fluids and or gases from a body part. So, since this procedure is not focusing on a body part, instead, the fluids or gases that are within the body part, you're going to see procedures here like incision and drainage of an abscess, chest tube insertion for removal of pleural infusion, or where they make an incision into a joint to remove drainage. So, oh yeah, a drainage procedure can be can be a diagnostic biopsy. We already talked about that, right? And so, just as with excisional biopsies and extractions, the character value of X for the seventh character is stating that the doctor wants to identify what's going on. And that's the reason that he's sending this specimen to the lab. Now, you probably are wondering, why do I keep saying that over and over again? And that is because whenever a doctor takes out a body part, they send it to the lab because they want to make sure that nothing else is going on with it. Diagnostic qualifier is only used when that specimen is being sent to get a diagnosis. So hopefully that is clear. Let's see what else. Let's see. Do I have some guidelines? Oh no, I don't have a guideline. Let me just look for a second. Well, one guideline, I guess, let me just go back so you're not confused on what I'm talking about. One guideline that could be applied here is B21A, and it's not a root operation guideline, but it is just a guideline, I would say, in general, which is basically stating, so B21A, which is basically stating that procedure codes in anatomical regions, general anatomical regions, upper extremities, and anatomical regions, lower extremities, can be used when the procedure is performed on an anatomical region rather than a specific body part. And so, in the guidelines, they give an example of a chest tube drainage of the pleural cavity is coded to the root operation drainage, and it's found in the body system of anatomical regions. So that is why guideline B2.1A would be a great guideline to check out here. Um, let's go on to our next root operation, which is extirpation. I remember I remember I'm laughing because I'm thinking back to my journey into ICD-10-PCS. There were literally about 200 of us taking this training back in 2010. And when they said extra patient, we were like, what? Is there an extra patient? But no, extra patient, which is represented by character value C, is taking or cutting out solid matter from a body part. And the solid matter that is taken out of the body may be an abnormal byproduct of a biological function. So, like a blood clot, hematoma, thrombus. But it also could be a foreign body, such as a piece of glass, right? So, in any case, the solid matter is not the body part itself, right? The solid material from the body part, and that material, whatever that material is the focus of the procedure rather than the body part itself. Okay, so of course, I am looking at I am looking for guidelines, and I came across guideline A11. And again, this is not a body part guideline, but it is a guideline nonetheless. And so this is page 4 of the guidelines, and you might hear me ruffling my paper, but because I have them in front of me. Many of the terms used to construct PCS codes are defined within the system. It's your responsibility to determine what documentation in the medical record equates to the PCS definition. Why? The physician is not expected to use terms in PCS code description, nor, this is a guideline, nor do you query the physician when the correlation between the documentation and the defined PCS terms is clear. I think that's such a good guideline to call out. All right, let's moving right along here. So the doctor is not going to say extirpation is the moral of the story. All right, the final root operation in group number 2 is fragmentation, which is breaking solid matter in a body part into pieces. It is character value F. And in fragmentation procedures, a physical force is used to directly or indirectly break the solid matter into pieces. So when I first got the definition, I was like, oh, lithotripsy. So if you're thinking lithotripsy, that is definitely the case. Now, fragmentation can be accomplished by ultrasound, manual, or other methods. And as indicated in extirpation, the solid matter involved in the fragmentation procedures may be an abnormal byproduct of a biological function or a foreign body. But here's the deal: in fragmentation, the material is not removed or taken out. If the fragmented material is taken out of the body, you use the root operation of extirpation. The fragmentation then would not be coded separately. As if you look at the definition, extirpation states that the material may have been broken into pieces. All right. I do have a guideline to call out here, which is B54. And let me get over there. This happens to be an approach guideline. So just as you are seeing, not all the guidelines are related to the root operation, but they apply. So B5.4, percutaneous procedure via device. So for procedures performed percutaneously via a device, placed for the procedure are coded to the approach of percutaneous. And they give an example. Fragmentation of a kidney stone performed via percutaneous nephrostomy is coded to the approach percutaneous. All right, so that was that last root operation for that group. And now we are going on to our next group. And here We have group number 3, which are 2 root operations that involve cutting or separation only. Cutting or separation only. And the definitions of these 2 root operations are different than group 1, right? Group 1, excision, resection, detachment, where it was cutting, but also to take out all or some of a body part. Division and release involve cutting and separation, but what's not happening here? They're not taking out any body part or other material. I think it's so important to really lean into the different nuances because that will help make or break your code selection. All right, so division, cutting into a body part without draining fluids and or gases from the body part in order to separate or transect a body part. Whoo, what's the key word here? Separate, right? That is so important. Oh, character value number 8. So in the root operation, division, all or a portion of a body part is separated into 2 or more portions, right? Which is going to be different than the next root operation that we're going to see, which is going to be the root operation of release. And release is where you are freeing a body part from an abnormal physical constraint by cutting or by the use of force. So let's pause for a second. What is the difference? Um, Division, you're separating. Release, you're setting it free. All right. So I think I have a guideline here, 1 or 2 for release. The first one is B313. And I said I wasn't going to read these guidelines, but I feel like I've been going through each one. So B313, in the root operation release, the body part coded is the body part being freed and not the tissue being manipulated or cut to free the body part. And then guideline B314 just brings us all back to full circle of the difference between release versus division. So, if the sole objective of the procedure is freeing a body part without cutting the body part, the root operation is release. If the sole objective of the procedure is to separate or transect a body part, the root operation is division. So, the key here, 2 words. And these are questions that you're going to ask yourself. Am I separating, or not you, the doctor's doing the work. Are they separating or are they freeing, right? Separating or freeing. That's a good tip there. All right. Let's keep going. We are now going to group number 4. So group number 4, root operations that put in, put back, or move some or all of a body part. So we have 4 root operations in group 4: transplantation, reattachment, transfer, and reposition. These procedures focus on the body part that is being put in, put back, moved, rather than on, some type of device. Now, there may be a device that is a part of the procedure, but that's not the focal point. All right, so first root operation, character value Y, transplantation, putting in or on all or a portion of a living body part taken from another individual or animal to physically take the place and or function of all or a portion of a similar body part. All right. So I got a couple of things to say over here. So, number one, transplantation procedures have a seventh character that has one of three values, and that's allogenic, synogenic, and zooplastic. So allogenic taken from, and it's a character value of 0. I didn't put that in the description, but I could have. um, 0 taken from different individuals of the same species. Synogenic has to do with individuals or tissues that have the same identical genes, such as identical twins. And then zooplastic is a tissue from an animal to a human. So, transplantation procedures are typically for complex organs such as heart, large intestine, thymus, and kidney. And it should be noted, however, PCS has its own rules. And the term transplant is going to be used by the provider to refer to other procedures that don't meet the criteria for transplant in PCS. Like, it's a transplant in real life, but from a PCS perspective, it's not counted as a transplant. For example, provider may document cornea transplant from a cadaver donor. That is not a transplant in PCS. There is no code for transplantation of the cornea. Why? It's not a living body part, it's a layer of tissue in a portion of a body part. And so for cornea transplants, the root operation would actually be replacement. Okay. Let's talk about, I think I got some guidelines. Yeah, B316, which is transplantation versus administration. So, putting in a mature and functioning living body part taken from another individual or animal is coded to the root operation or transplantation. Putting in autologous or non-autologous cells is going to be coded to the root operation or coded to the administration section. Um, Another guideline I want to call out here that I think is really important. Go over to A11. A11, which I think I talked about A11 already, but I think it's important to call it out here. So I'll give you 1 second to turn over there, and you should have this in your guidelines. So A11, many of the terms used to construct PCS codes are defined within the system. It's the coder's responsibility to determine the documentation. So you you again have to make that what's the word? You have to use the guidelines to come up with that correct code. And I think that's probably one of the biggest challenges is that physicians don't know PCS. They don't take a PCS class. In fact, physicians don't take any type of coding class. So it's us that are doing the job. And remember, this is why when I do these review classes, I really try to go beyond the exam, because just telling you what you need for the exam is not enough. You pass now, so what, right? Can you do the job? All right, next root operation is reattachment, putting back in or on all or a portion of a separated body part to its normal location or suitable location. So, this is body part value M. And in reattachment procedures, the body part has been cut off, um, or avulsed, and it's reattached. In these procedures, it should be noted the blood supply is restored, and the nerve supply may or may not be restored based on the circumstances of the procedure. All right, we are now going on to transfer. Transfer is moving without taking out all or a portion of a body part to another location to take over the function of all or a portion of a body part. So notice moving without taking out, moving without taking out. So in the guidelines, they give you some examples of procedures, but I want to just call on guideline B317 and B317 transfer procedures using multiple tissue layers. The root operation transfer contains qualifiers that can be used to specify when a transfer flap is composed of more than one tissue layer, such as a musculocutaneous flap. It tells us what to do there. Okay, because I don't want to read all of that because I don't want to run out of time. All righty. And next up, we're going to talk about reposition. Reposition, character value of S, letter S, moving to its normal location or other suitable location, all or a portion of a body part. So, in reposition procedures, the body part can be resituated from an abnormal location or from its normal location where it's not functioning properly. The objective of the procedure, that's the key to the root operation for all of them. The objective of the procedure here is to move to restore or establish normal function. One of the most common procedures that you're going to see for reposition is a fracture reduction. And when a doctor is reducing a fracture, the part of the bone that was misplaced is restored to its proper location. It should also be noted that a device may be used as part of the procedure. And of course, that device would be the sixth character value. The device could be internal or external. And reposition is actually an example of an ICD-10-PCS term that is going to be different from what you're going to see in the documentation. The documentation is going to say reduction. The physician does not have to state reposition. They just have to do the work. It should also be noted that if the patient has a non-displaced fracture, that is not coded to the root operation of reposition. So only displaced fractures are coded to reposition. Okay. A non-displaced fracture would not be treated with a reposition because the bone is not moved. And so that leads me to guideline B315. B, B315 says reposition for fracture treatment. Reduction of a displaced fracture is coded to the root operation reposition, and the application of a cast or splint in conjunction with reposition is not coded separately. Then they go on to tell you if it is a non-displaced fracture, it's coded to whatever they do, such as the guideline talks about immobilization is an example. Um, all right. So I think that it is time for another 5-minute break. All right, we are back and we are now moving on to group number 5, root operations that alter the diameter or the route of a tubular body part. So, um, this group has 4 root operations, which are restriction, occlusion, dilation, and bypass. The other thing I want to just really make sure I'm intentional about specifying is that a tubular body part are those that are hollow. I want you to visualize this. A tubular body part are those that are hollow and allow for passage of solids, liquids, or gases. Examples of tubular body parts are the vessels in the cardiovascular system and tubular portions of genitourinary, respiratory, gastrointestinal, and biliary tract. And each of these root operations has an objective of changing these tubular body parts in some way. Tubular body parts are very unique. They're typically not transferred as other body parts may be. Instead, the contents of the tubular body part can be rerouted. The diameter could be made smaller. It could be cut off. Um, so let's get into the roots. So the first one is restriction. Restriction is character value V. And I hope if you didn't, that you go back and put the character value on your flashcard. And for those of you who are like, what am I supposed to do with the flashcards, right? The word root operation on the front, the meaning on the back. Restriction is partially closing an orifice or the lumen of a tubular body part. All right. So the objective of restriction is to partially narrow the diameter of a tubular body part or an orifice. In this particular area, you may see um, some devices being used. Okay. Um, and I think that's all I got to say about that. All right. Root operation occlusion, which is represented by the character value of L. Uh-oh, look, completely closing an orifice or the lumen of a tubular body part. Character value L, occlusion has an objective of complete closure. As with restriction, an occlusion can involve a natural or artificial opening for procedures on the orifice. You may hear the words intraluminal or extraluminal, so inside the lumen, outside the lumen. The character value for device is going to vary. So both root operations, restriction and occlusion, involve closing an orifice or the lumen. What's the key word? Partial for restriction and total for occlusion. I have a guideline, B312, and B312 is occlusion versus restriction for vessel embolization procedures. If the objective of the embolization procedure is to completely close a vessel, the root operation occlusion is coded. If the objective of the embolization procedure is to narrow the lumen of a vessel, the root operation of restriction is coded. All right, we are going on to, and I did mention this. Let me just go back because I just want to make sure that I said this. I'm pretty sure I did. I mentioned that intraluminal or extraluminal devices can be used in occlusion procedures, right? Okay, I want to make sure I cover that. All right, so next up we have dilation, expanding an orifice or the lumen of a tubular body part. The objective of dilation is opposite of that of a restriction or occlusion. Dilation involves making the orifice or the lumen larger instead of smaller. Ooh, that's good. As true of restriction and occlusion procedures, dilation also includes intraluminal and extraluminal devices to accomplish the enlargement. An intraluminal pressure can be used to stretch a tubular body part, which then makes it larger. One of the things that I would highly recommend as you are coding, learning PCS, because I know only two of you actually do inpatient coding. Um, it is important to understand how the procedure is done because I think that will make selection of the routes just a lot easier. Okay, so what else did I want to tell you? Oh, many dilation procedures involve the use of a device that is left in place after the procedure to maintain the expansion of the tubular body part. And so, of course, the device is going to be represented with a character value from the 6 character family. Okay. Um, just remember that devices that are integral to the procedure, not left in place, they're not coded separately. All right. Dilation has a lot of things going on. Okay. So let me give you some procedures to kind of look up just as we talk about dilation. One of them is a PTCA, percutaneous transluminal coronary angioplasty. This procedure is used to expand coronary arteries that have been blocked. Like the patient can have atherosclerosis, like they got fat or plaque. And in this procedure, PTCA, the artery is stretched via a balloon that is placed into the vessel via a guide wire. At the blockage site, the balloon is inflated to compress the obstruction. And then once the blockage is clear, the balloon is deflated and blood can flow freely through the vessel and to the heart muscle. And as I know you probably know from the CPT world, the procedure may also involve placing a stent within the coronary artery to keep the vessels open. Now, we got some rules. We got some different rules here. So hopefully by now you've relocated over to B44. In PCS coding, dilation of coronary arteries is approached differently than the dilation of other vessels. Let me say that again. In PCS coding, the dilation of coronary arteries is approached differently than dilation of other vessels. The first difference is the body part value. The coronary arteries are considered one body part, and the body part value is based on the number of coronary arteries that are treated. An example of this can be found in table 027. So if you want to turn over to table 027 in your PCS manual, and what you'll notice is character value 0 for a body part, 1 artery, 1 for 2 arteries, 2 for 3 arteries, 3 for 4 or more arteries. Also, The device character for these codes, PTCA, has values for different devices. Drug eluting intraluminal device. Intraluminal device, also known as a bare metal stent. Radioactive intraluminal device. And then there's also, of course, no device, right? So with the drug eluting, there's an intraluminal and there's a drug eluting intraluminal and then intraluminal. So if you've made it over to table 027, you'll see 4, 5, 6, 7 says intraluminal device drug eluting. And then you have D, E, F, G, which is just for intraluminal device. All right. So many different things. All right. So now, guideline B4, is that right? B4, yeah, B44. All right. Let me get over there. And this is actually a body part guideline, which I actually already told you about. But anyway, B44, coronary arteries. Coronary arteries are classified as a single body part that is further specified by the number of arteries treated. And then also we talked about the same device and qualifier values. And as you already know, when you're coding on the tables, do not skip around. Go straight across. All right. Next up, we are going to the root operation of bypass. Bypass is character value number 1, altering the route of passage of the contents of a tubular body part. So, bypass procedures represent rerouting procedures. And I'm pretty sure you've heard of many of these bypass procedures. So, this can involve rerouting contents of a body part to a downstream route or to a similar body part and route. So you may heard of a femoral popliteal bypass procedure that reroutes blood around the blocked areas of the femoral artery to the popliteal artery, which is in the knee. Other types of bypass procedures reroute contents to an abnormal route and different body parts. For example, excess cerebrospinal fluid from the spinal cavity may be rerouted to the atrium of the heart. So, bypass procedures can also include anastomosis. You guys have heard of that before because it's a CPT thing. Or surgical union of tubular body parts that are separated in the bypass procedure. Also included are any devices that are used in the bypass procedures. So, the bypass procedures are subdivided into those involving the coronary arteries and other bypass, not including the coronary arteries. This is important. Very, very important. For non-coronary artery bypass, the body part value indicates where the bypass originates or comes from. And the qualifier character denotes where the bypass goes on to or terminates. This is very important, and we will see that in a guideline or a guideline or 4. All right, so we're going to first go to B3 6A. I can't believe PCS has been around for 10 years. Wow. I should do a PCS turns 10 party. I think I definitely will do that. All right. So let's see. B36A. Bypass procedures are coded by identifying the body part bypassed from and the body part bypassed to. The fourth character specifies the body part bypassed from, and the qualifier specifies the body part bypassed to. Guidelines give us an example. Then we have B363. Coronary artery bypass procedures are coded differently than other bypass procedures, so different than B36A. Rather than identifying the body part bypassed from, the body part identifies the number of coronary artery bypass to, and the qualifier specifies the vessel bypass from. Very important to note that. B36C says if multiple coronary arteries are bypassed, a separate procedure is coded for each coronary artery. Watch this, that uses a different device and or qualifier. All right, and then we have B39, which I called out previously, but I don't think we talked about it, so we can talk about it now. B39, excision for graft. If an autograft is obtained from a different procedure site in order to complete the objective of the procedure, a separate procedure is coded, except when the seventh character value in PCS table fully specifies the site from which the autograft was obtained. So one example that the guidelines call out is a coronary bypass with excision of a saphenous vein graft. The excision of the saphenous vein graft is coded separately. So I equate that to in CPT how we code bypass and how that graph is included. But if it's endoscopic vein harvest, is separate. So that's same but different. All right. I think that is all I wanted to cover for this one. So let me keep on going. All right. So next, we are going to look at group number 6, root operations that always involve a device. So here you have 6 root operations: insertion, removal, revision, change, replacement, and supplement. So these root operations: put in, take out, correct, exchange, or use a device to take the place of or reinforce a body part. Key to each of these root operations is what? The device, which is the focus of the procedure. All right, so let's dig in here. So we're going to start with the character value of H for insertion, putting in a non-biological appliance that monitors, assists, performs, or prevents a physiologic function, but does not physically take the place of a body part. So here, the device may monitor, assist, perform, or prevent a function. However, for insertion procedures, the device does not physically take the place of the body part. Let me say that again. The device may monitor, assist, perform, or prevent a function. However, for insertion procedures, the device does not physically take the place of a body part. So, in these procedures, the sole objective of the procedure is to put the device into the body part without doing anything else. If the objective of the procedure goes beyond inserting the device, then that procedure is coded instead of insertion. And then you would use the device as the device character. Okay. Moving on to the next root operation is removal, taking out or off a device from a body part. So, removal, character value P, and in comparison, insertion involve putting the device as the objective of the procedure. Removal is taking out that device. There's a wide range of procedures that are included in the removal root operation, which involves taking out a device in a variety of body parts. Um, when you look at the table for a table that has a device qualifier, the one thing I want to call out is paying attention to the device itself, because you may see the device reported in more than one row, but um, it is the approach that will change what that final code is going to be. So to qualify as a removal root operation, a device such as a drainage device, external fixation device, intraluminal device must be involved. The term removal, and I know you guys are thinking about this from a CPT perspective, the term removal may be used in documentation to say removal of an ovary, but you already know this. Ovary is not a device, it's a body part. And so that would be coded as a resection. So for me, when I learned, resection if they take out the whole ovary, excision if they take out part of the ovary. So when I learned PCS, I had to just be intentional about saying, okay, if it's a device, it is not a resection or an excision. Let me go back for a second because there is a guideline for devices, and let me just find it here. Um, Page 17 in the guidelines. I'll give you a second to get over there. All right, B61A. A device is coded only if the device remains after the procedure is completed. If no device remains, the device value of no device is coded. Now I'm going to move on to the root operation of revision. Revision, cutting, or not cutting, correcting to the extent possible a portion of a malfunctioning device or the position of a displaced device. So this is root operation revision, which is represented by the character value of a W. So in a revision procedure, the objective is to fix a device that is not working correctly or has moved out of its proper place. If the entire device is removed, this is not a revision. Instead, it would be a removal or something else. A portion of a device may be taken out or put back to accomplish the revision. And in revision procedures, the device is the focus of the operation. If we are replacing only a portion of a device, that's also coded as a revision. So, very important to note, the device has to be involved in the revision procedure. If the procedure is performed on a body part rather than a device, revision would not apply. Okay, I'm pretty sure I don't have any guidelines for that. Change. Gotta make a change. All right. Root operation change, represented by character value number 2, is going to be taking out or off a device from a body part and putting back an identical or similar device in or on the same body part without cutting or puncturing the skin or a mucous membrane. So, this is character value number 2. And to qualify as a change procedure, the same or comparable type of device is put back in the body part after removing the original device. All of this has to be done without making an incision or perforating the skin or mucous membrane. When this, when this, when I first learned PCS, let me just tell you what my brain went. Instead of calling it change, why don't you call it exchange? Because that's what you're actually doing. So that's probably what you're going to see in the documentation. And of course, you just got to go with it because that's what is happening. All right, next up, we have replacement. Replacement is putting in or on biological or synthetic material that physically takes the place and or function of all or a portion of a body part. So, in replacement procedures, the original body part may be taken out before the replacement is complete. It could also be destroyed before the replacement or made functional in some other way. Any of these methods to remove or disable the original body part are considered inherent to the procedure. It's part of the preparation. Therefore, they are included in the replacement procedure and are not coded separately. And this is noted in a guideline, which, oh, I don't have it on here. Okay, let's just, I got to get to these guidelines. So go over to guideline B3 1 B3 1B. B3 1B. B3 1B. So B3 1B states components of a procedure specified in the root operation definition or explanation as integral to the procedure are not coded separately. Furthermore, procedural steps necessary to reach the operative site and close the operative site, including anastomosis of a tubular body part, are also not coded separately. And while we're here, let's also go over to B318. B318. And B318, excision, resection, followed by replacement. If an excision or resection of a body part is followed by the replacement procedure, code both procedures to identify each distinct objective, except when the excision or resection is considered integral and preparatory for the replacement procedure. Now that I've seen that word so many times, I can say it, preparatory. Okay. I think that is all I wanted to cover here. And we are definitely going to get through all of these tonight. So I'm so happy. All right. Supplement. Putting in or on a biological or synthetic material that physically reinforces and or augments the function of a portion of a body part. So, supplement, putting in a device that supports or strengthens a body part or a portion of a body part. So, a perfect example, and I know you guys know this from CPT World, hernia repair using mesh. The mesh is used to enhance the procedure. Except, watch out for this, if the hernia is repaired without mesh, the root operation is repair. We haven't gotten to that yet. Another example of supplement is repair that's done as a part of a carotid endarterectomy. So, in this procedure, after a thrombus is removed, a portion of the vessel may be weakened at that site where the thrombus is, and they may put in a patch for reinforcement. So, the patch is a device that serves to reinforce or augment the vessel. Um, in that example that I was just talking about, the thrombectomy in that procedure would be coded as well. It would be coded as extirpation. So the removal of the thrombus is extirpation. And then when they put that patch, it would be supplement. So that's a perfect example of where you could have a scenario where there's more than one root operation. And I don't think we've talked about that before, but that definitely is something that could happen. So, supplement procedures augment the body part without replacing it. Replacement procedures, some or all of the body part is replaced by a device. In a supplement procedure, the device is added to the body part to augment or reinforce the body part. So, another example, penile prosthesis is inserted to augment or reinforce the function of the body part. The penis is not replaced. Supplement can also be compared to a repair, which I talked about the hernia. And when we get to that next group, we can talk about that. Oh, another great example, um, a mitral valve repair uses an annuloplasty ring. That's a supplement, right? The ring is a device that reinforces the mitral valve. All right, we are going to take another break. This time we will do a 10-minute break. All right, guys, we are back. And now we are starting with group 7 root operations that involve examination only. And there's only 2 root operations here. So, first, oh, I feel like that is so wrong. That definition is definitely wrong. I apologize. Can't change it right now, but inspection is visually and or manually exploring a body part. I don't know how I did that. So, examples of this procedure would be like a bronchoscopy, a colonoscopy, an atherotomy. Those are all examples of inspections. If this is a visual inspection, keep in mind that instruments such as endoscopies may be used. If it is a manual exploration, this can be accomplished directly or via intervening body layers. And when the exploration expands into multiple body layers, the deepest body layer is coated. And that is noted in a guideline. And so, again, sorry about that. I'll have to make a note to update my slides. Well, at least you can tell that I am typing my own slides. And when it's time to present, that's when I oftentimes realize that I made a mistake. So, but this just proves that no one is perfect. All right. So, first up, we have guideline B3.5. B3.5. So, B3.5 says overlapping body layers. Overlapping body layers. So, and I just said this. If the root operation, such as excision, extraction, or inspection, are performed on overlapping layers of the body layer system, the body part specifying the deepest body part is coded. Another guideline that could apply to inspection is B3.3. If the intended procedure is discontinued or otherwise not completed, code the procedure to the root operation performed. If the procedure is discontinued before any other root operation is performed, code the root operation inspection of the body part or anatomical region inspected. All right, and then we have guideline B311 A, B, and C. So first things first, let me just make sure I'm clear with this. Inspection procedures have the objective of looking rather than doing. Okay. Um, the inspection can be the objective to begin with, or it could be a procedure that started as something else but was canceled due to unforeseen circumstances. So that's where that B3.3 comes into play. All right, B3.11a. If an inspection of a body part performed in order to achieve the objective of the procedure is not coded separately. So, inspection of a body part or parts performed in order to achieve the objective of the procedure is not coded separately. B3.11b, if multiple tubular body parts are inspected, the most distal body part is coded. If multiple non tubular body parts in a region are inspected, the body part that specifies the entire area inspected is coded. And of course, these guidelines have examples. B3.11c, when an inspection procedure and another procedure are performed on the same body part during the same episode, if the inspection procedure is performed using a different approach other than the other procedure, the inspection procedure is coded separately. So, inspections of multiple tubular body parts in the same body system do not have an inspection area for each area explored, but rather the most distal area is coded. That's the 11, um, 11B, and then 11C is when you have an inspection and another procedure. All right, we're almost done. We are almost done. On to mapping. So, root operation K, and I don't know if I said this, but I don't think I did. Inspection is the letter J. So, map, locating the route of passage of external impulses and or locating functional areas in a body part. So, this root operation is only used for the central nervous system and the cardiac conduction mechanism. This is a very small group of codes that encompasses only really two code tables, I believe. 00K, that's in the central nervous system, and then 02K, which is in the cardiac system. And I don't have anything else to say about that. On to group number 8, root operations that define other repairs. All right, so here we have two root operations, okay? The first is, of course, the root operation of repair. And repair is represented by the character value of Q. And repair is what we like to call an NEC value. Now, I know you're thinking NEC, that sounds familiar from CM. Yes, NEC, not elsewhere classified. So keep in mind that ICD-10-PCS has a goal of specificity. And the codes and the character values, we can get them as precise as the system allows, right? Repair is NEC, meaning we can't code it anywhere else, okay? So this root operation applies if no other root is appropriate. If the objective of the procedure is reflected in a different root, then that root operation should be selected. So, for example, let's say a patient had an ACL, an anterior cruciate ligament. It's this past weekend, March Madness. I'm like, everything on TV was off for March Madness. I am a NFL, NBA girl. I don't watch college sports at all. So anyway, let's say an ACL, anterior cruciate ligament repair, is accomplished by repositioning the ligament to its correct place. We would use the root operation of reposition as opposed to repair. And remember how we talked about repair with like a hernia, right? But it's only the repair that doesn't include mesh. If they use mesh, we wouldn't code it. Repair procedures do not include a device of any sort. If a device is left in place at the conclusion of the procedure, repair is not your root. Okay? So, let's see what else I want to tell you. You may find that doctors use the term reconstruction in their documentation, and it is interpreted as a type of repair. But because the root operation repair is the last resort, only when no other root operation applies, you really need to really think through if this is really a repair, right? Because it could be a transplant. not a transplant, a transfer. It could be a replacement. It could be a supplement, right? So you really want to make sure that this is truly a repair, right? So ask yourself questions like, is some or all of the body part removed? If so, is a device used to reconstruct the body part, right? That would be replacement. Um, I think that's all I want to say about that. And now we're going on to control. This is character value number 3, stopping or attempting to stop post procedural or other acute bleeding. So this is represented by character value number 3. And only, I think, you can double check this. Only 4 body systems use the root operation of control. Um, Ear, nose, and sinus, anatomical regions, general, anatomical regions, upper extremities, lower extremities. So, yeah. So, control procedures include preparing the operative site, using irrigation, and removing any hematomas may be present. It should be noted, and there is a guideline. I hope I have the number here. Yep, B37. B37. Control versus more specific root operations. The root operation control is defined as stopping or attempting to stop post procedural or other acute bleeding. Control is the root operation coded when the procedure performed to achieve hemostasis beyond what would be integral to a procedure utilizes techniques such as cautery, application of substances or pressure, suturing, ligation, or clipping points at a site that are not described by a more specific root operation definition. Pause for a second. So basically, what that is saying is you're going to use this root operation when of control when no other specific approach was done or a more specific route was done. So, for example, the guidelines talk about if they control the bleeding by doing a bypass, a detachment, excision, extraction, reposition, replacement, resection. If one of those were used to control this bleeding, then that more specific root operation is used instead. In the guidelines, they call out 3 examples, which I think are worthwhile reading. All right. Our last group is going to be group number 9. And this is root operations that define other objectives. And so these root operations are fusion, alteration, and creation. Fusion, alteration, and creation. All right. And I don't think I added um guidelines. I think by the time I got to the end of the slides, I was like, forget it. So fusion is going to be root operation of G, and fusion is joining together portions of an articular body part, rendering the articular body part immobile. So, by definition, Fusion can only be performed on joint structures. Why? The objective of this procedure is to make the joint immobile by fusing the articular parts. Examples of fusion procedures could be like a spinal fusion, fusion of the joint, hands, or feet. And I do have guidelines. All right, so we have B3, 10A, B, and C. So let's start there. So let me give you a second to get over there. And while you're doing that, I did want to call out, because we're talking about joints, this is just a reminder. When you're building codes for a spinal fusion, the tables are consulted or selected based on the level of spine that's in the fusion procedure and the factor used to designate the number of body parts on a joint. However, not the vertebra. So, for example, if you look at table 0RG, that's medical and surgical upper joints fusion, you'll see that they talk about the the joints, okay? And they will mention the words like cerebral, thoracic, thoracic lumbar. So just thoracolumbar, just pay attention to that. All right, B310A. The body part coded for a spinal vertebral joint rendered immobile by a spinal fusion procedure is classified by the level of spine. There are distinct body part values for a single vertebral joint and for multiple vertebral joints at each spinal level. So that's 10, 3, or B310A. B310, oh my God, is that correct? Yeah, that's correct. B310B. I'm like, did I make another mistake? 10B, B310B. If multiple vertebral joints are fused, a separate procedure is coded for each vertebral joint. Watch this, that uses a different device and or qualifier. A different device and or qualifier. And then we got a long guideline, B310C. Combinations of devices and materials are often used on a vertebral joint to render the joint immobile. And when combinations of devices are used on the same vertebral joint, the device value is coded for the procedure as follows. And I'm not going to read this, but they basically break the guideline into if there's a interbody fusion device, a bone graft, or a mixture of autologous and non-autologous bone grafts. Okay. Um, so, and somehow I clicked to the other slide while I was reading my notes. Okay. So, or reading the guidelines. The other guideline that I wanted to call out here was B39. And this one states, we've seen this before, if an autograph is obtained from a different procedure site in order to complete the objective of the procedure, a separate procedure is coded, right? That's what that says. Yep. Okay. And now we're going to go on to alteration. And alteration is modifying the anatomic structure of a body part without affecting the function of a body part. So this is character value 0. And alteration procedures are those that are performed for cosmetic purposes. That is, improving the patient's appearance. So, included would be things like eyebrow lifts, breast augmentation, breast reduction, otoplasty, making the ears smaller. Because there are some procedures that can be performed to alter the appearance or for medical purposes, the reason for the surgery has to be in that documentation and analyzed. So, for example, the patient can have an eyelid lift or a blepharoplasty for medical reasons. And in that case, it wouldn't be an alteration, it would be replacement, supplement, reposition, or repair. If the eyelid sags, right, to the degree that it interferes with being able to see, um, as a result of something like myasthenia gravis, a reposition would be more appropriate. But if it's solely done for appearance purposes, root operation alteration would be used. So, alteration is the only instance where diagnostic information affects the code. Alteration could be performed with another procedure. So, for example, the patient has a wide excision of a malignant lesion of the right breast with a left breast reduction mammoplasty for symmetry. The removal of that lesion, that's excision, and then the reduction mammoplasty is alteration. So, I guess a key takeaway here is it alteration to improve appearance, or is there a medical need? And the doctor would need to specify what that medical need is. All right. Last root operation is going to be creation. And creation is putting in or on biologic or synthetic material to form a new body part that, to the extent, replicates the anatomic structure or function of an absent body part. Okay, so there's really two main purposes, I would say, of the root operation creation. The original use of this body part or this root operation was for gender reassignment operations. And so, one example of the table would be 0W4, which is changing genital structures from male to female or female to male. And the body part value in the code describes the structure that's present at the start of the procedure, whereas the qualifier describes the structure at the conclusion of the procedure. And from a device perspective, you're going to see things like autologous tissue substitute, zooplastic tissue substitute, synthetic substitute, um, non autologous tissue substitute. So pay attention to that. Recall that if an autograft is used in the procedure, auto itself, the harvesting of this tissue from a different site is coded separately. I think that's like B39. All right. And then the second use of the root operation creation is for the heart and great vessels. And here, creation represents creating a body part with a device to serve as a body part that's actually absent in the patient. And so here, this would be body parts like aortic valve, mitral valve, tricuspid valve. All right. So we have, oh my gosh, we have gone through all of the root operations, all 9 groups. And so now I want to give you some time to look at something that I mentioned to you the other day. And I know that some of you probably didn't have an opportunity to do it. And so I want to give you the opportunity to do it now. And I'm going to actually share my screen to show you. But before we do that, I just want to just reiterate that we are focused on the medical and surgical section. So Wednesday, you will have an exam that will consist of 100 questions where you are basically going to look at the procedural statement, thumb through your flashcards, and figure out what the correct root operation is. And then what else? And then that will wrap up this particular week. And then the following week, which I think is the 30th or the 31st, you guys are going to be um doing those inpatient records. So I am going to provide you with some tips related to the PCS code portion, but that's what you will be doing essentially the first week of April. So March 31st, and then I think it's April 2nd. So you'll be entering your codes for those inpatient records. So I hope that you have been um, going through them as opposed to waiting to the last minute because it's not going to be fun. All right, so let me share my screen. And I showed you this before, but I want to share it again. So I have a YouTube playlist that I started recording this in 2019, but it's still appropriate today. You can definitely skip past the introduction to the PCS system, the guidelines, because they may have changed. But I would recommend that you take some time now to go through these videos, starting with body part, surgical approach, and then dissecting the operative report, because you are going to be coding reports in those inpatient records, and I just want you to be prepared. So 10 videos on dissecting the operative report plus the introduction to the operative report. You see here that I am you see my hand in here, right? So I'm thumbing through the book. I am writing on the pages, highlighting, underlining, all the things. And so it's so very important that you are doing that. So I want you to take the rest of the class now to do that, because that's going to be very important as we wrap up this journey. So you got 45 minutes to get through as many of those videos as you can. Please, please, please take this time now to do that, because every day goes by is getting you closer to the end of this journey, and not life, but this CCS exam prep. So I will put music back on again. And when the music goes off, that'll let you know that our 3 hours are up. But I got to have some music. It keeps me relaxed. It just occurred to me that many of you are probably trying to watch the video and the music is distracting. So I am going to turn it off, but you still have 40 minutes left. So please watch those videos so that you can strengthen your skills, because I know all of you did not watch them this past weekend. And if you did, then that gives you time to flash through your flashcards and your guidelines. Hi, everyone. So that is our time for today. I will see you on Wednesday, where we will be doing again the activity that I mentioned, 100 questions, where you're selecting the root operation. See you then. Music to leave out. Bye.